Intubation and types of ventilators, starting on page 628. Mechanical ventilator is like an air pump. Pumps air into the lungs, but with a machine. It's a positive pressure ventilation, which is different than normal breathing. In normal breathing, the diaphragm in the lungs use negative pressure to bring in oxygen versus it being blasted from positive pressure being pushed into the lungs over here with the ventilator, the machine. If a patient's unable to breathe adequately on their own, they need an artificial airway. The most common is a short-term airway called an endotracheal tube or an ET tube. Proper placement. Patient's head will be slightly tilted back. A laryngoscope is used, helping guide the tube to proper position. The laryngoscope is inserted into the mouth and down into the throat. The blade will raise the epiglottis, and the tip of the ET tube will be advanced into the trachea. A small balloon is then inflated to keep it in place. Then the laryngoscope is removed, and the tube is secured on the patient on their face by tape. Placement must be checked to assure proper positioning, usually done by a chest x-ray. If the end of the tube is too low, then both of the lungs will not receive the same amount of air. It's then connected to the mechanical ventilator. This aids respiration by delivering well-oxygenated air into the lungs and permitting CO2 to escape from the lungs. These levels are closely monitored by RT. Depending on the condition of the patient determines the type of ventilator. There are non-invasive ventilators in which the patient wears a mask that fits over the nose and mouth and the air blows into the lungs. And there are different types of invasive ventilators with the tube. The different types. Pressure cycled ventilator, where the air is delivered to the patient until a set pressure limit is reached. Then there's a time cycled ventilator. This is when it pushes air into the lungs for a predetermined amount of time until that has elapsed. And then a volume controlled ventilator. A predetermined amount of air is delivered to the patient. Then we see a microprocessor ventilator. This is a computer-managed positive pressure vent, and it often uses all three components, the volume, time, and pressure. This type is more responsive for patients who have severe lung disease. So these all look similar, either with the mask or the patient is intubated with the tube, but the way it's delivered, like the type, is what is different.